Hi friends, Namaskar and a very warm welcome for this INI-CET May 2025 recall questions. A small disclaimer, all the topics and the questions that we are going to discuss in this video session are not intended to replicate directly the MCQs asked. The main intention is just to discuss about the topics and to see what pattern of MCQs are being followed. So, beta, this INI-CET May 2025, happy news is we had a decently easy level of community medicine questions. I think there were around 20-25 odd questions. Out of these 18-19 questions, anybody could solve it. These are relatively easy MCQs. We had 2 questions from epidemiology. Roughly this time we had 4 easy MCQs from biostats. Demography, mother-child health, family planning, they always take the center stage, 6 MCQs. Communicable disease, non-communicable, including the national health programs, we had 7 MCQs and 2 from miscellaneous topics. So let us take on the first topic, that is epidemiology. Beta, the first MCQ, what are the steps in research study? You have to mark them in chronological order. Formulating the objectives, selecting the sample population, study analysis, and formulating a research question. So what do you think is the first step? Beta, whenever we intend to do a research, the first step is always to identify what the problem is. What are you intending to do? And if you can identify the real problem that formulate a research question, then I think 50% of your research is actually done. So one is always option number D. That has to be the first thing always. This has to be the first thing. In the next level, once you identify the research question, then you see what you intend to do in that research question, that is to identify the objective, what you want to find out. So that is your second part. That is your next level. And then you are going to identify the study population, third level, and finally you would do the analysis, fourth level. So that is how you were going to do D, A, B, and C. This is what is the correct sequence that you would like to follow. D, A, B, and C. So the correct answer is option number D. Going to the next MCQ, a researcher studies the incidence of measles in a population of 100. 10 children had previous history, 20 had been affected for the first time. Calculate the incidence. What else you would have asked from God in this INI-CET exam? This is a super duper easy MCQ, how to find out the incidence beta. Incidence, if you talk, it is given by the formula total number of new cases divided by the total susceptible population. Susceptible population is the population which is at risk. Population at risk of the infection. And usually the multiplicative factor is 100, it could be 1000, whatever number. So if you just see this total number of new cases, how many new cases were there? We can see that 20 were the first new cases. So you had the 20 cases that were the new cases divided by total susceptible. So there were total 100 children, 100 may say, out of 110 already had infection. So correct answer is 20 over 90, which is roughly around 22%. So that is your correct answer. Coming to the next topic about biostats, what is odd regarding to the statistical parameters paired with the phenomena represented? This question I feel is not very easy, but not at all it is difficult question. So option A, if you talk about, is mean median will tell you dispersion, standard error will tell you variability, correlation coefficient is relationship, moments is skewness. So if you start from below beta, if you start from the lower area, that what is moments and what is skewness. So whenever we talk about a normal distribution curve, you can see that there are different normal distribution curves. I have made 1, 2, and 3. 3 curves I have made. So they all seem to be normally distributed. It is a bell-shaped curve. Now the bell, it could be a long bell. It could also be a flat type of bell. So this peakness, it is how peak the thing is. This peakness is called as kurtosis beta. Kurtosis means the peakness, how huge or how flat the peak is. Now there is also something called as the shape of distribution, that is called as moments, and moments is called as skewness, like where the peak is. Is it like this? Is it like this? So the skewness is measured in moments, or moments is measured in skewness. That is correct answer. Correlation coefficient will tell you relationship. So of course we know that there is a positive correlation, negative correlation, no correlation. So option C is also looking to be the correct answer. Standard errors will tell you about variability. Beta, we already remember that if this is a normal distribution, so you have one standard error, two error, and three, and backside -1, -2, and -3. So this will tell you how much dispersion or how much variations are there. So variability is definitely measured in terms of standard errors, because this is the center point, this is the mean, and how much the value is varying from the mean towards positive side or towards the negative side, that understanding is called as standard error. Now, mean and median, is it a value for dispersion? I don't think so. It will tell you dispersion. It will tell you that if this is your total data, just imagine that this is the data. So where is the center point? That center point is called as the central tendency, and that central tendency you can measure in terms of mean, median, and mode. So that is, in Hindi we call it as Kendra Bindu of the circle. So that Kendra Bindu, or the central point of the circle, that is what is mean, median, mode. So obviously option A is the only one which is not matching to the relative options. So A is the correct answer you would like to mark in this question. Going to the next one, quartile, deciles, percentiles are measure of. So this we have again discussed so many times in the lectures also, that there is something called as tiles. Tile, what do you mean by a tile? So tile means making the data into cut parts. So let us say that, I'll explain to you again. Let us say that there is a data. Let us imagine that there is a data, and you put it in ascending descending order. You take the minimum value and you take the maximum value. Let us take a scissor and you cut this data. Scissor and cut and cut. How many cuts did you make? You made how many cuts? I made 2 cuts with the scissor. And how many parts did you make the data into? If you put 2 cuts, the data is divided into 3 parts, 1, 2, and 3, each of 33%, 33.3, 33.3%. So these parts, how many parts? 3 parts. So technically we don't call the part as part, we call them as tiles, beta. And technically we don't call the cut as the cut, we call them intercepts. Okay, and then what is the name of this? This is called as 3 parts or tertile. This is called as tertile. Tertile or 3 parts. This is what is tile system. So common sense, if you understand that if there are 3 intercepts, so you take the data and you put cut 1, cut 2, and cut 3. So how many parts did you divide them into? 4 parts. The name is a quartile. And if you take 9 intercepts, how many tiles, how many parts, beta? 10 parts. What is the name? It is not a tentile. It is called as a decile. If, for example, you put 4 intercepts, how many tiles? You will make 5 tiles. What is it called as? 5 tile, pentile, also called as quintile. Quintile, or some people might also call it as a pentile. So you have 5 parts, 5 intercepts, and 6 parts. It is called as hexile. 9 parts is decile, and 99 cuts. If you take 99 cuts, how many tiles will you make? 100 tiles. It is called as 100 tile, also called as centiles. So what is the use of these tile systems? The use of these tile systems is that this point is going to tell you that you are in which box. If you score, let us say that you score 165 marks out of 200. Okay, so that is roughly around 70-80%. But what if you are the topper, or the topper scored 167 and you scored 165? So you are in which part? If I take the whole data, I divide it into 100 tiles, also called as a centile. So let us say you are in the 99th centile. We call it as the 99th percentile. It's not 99th percentile. It's not percentile. It's percentile. So centile will tell you, beta, that you are in which particular box. That understanding box or the location is called as a centile system or a decile or a percentile system. So the correct answer is that this tile system is going to tell you about location, that you are located in which particular box. Coming to the next MCQ, in a PHC, beta, a researcher measures the weight of group of 100 patients with DM, diabetes mellitus, so 100 patients, and follows them after 6 months to provide nutritional counseling. So you take 100 patients, all with diabetes mellitus, you follow them up for 6 months. With nutritional counseling, a medical researcher goes back and takes the data to perform a statistical signal. What test can be used to analyze the weight difference? So you want to check the body weight before 6 months and body weight after 6 months. So what is the test of significance. If you remember beta, there are different types of test of significance. The test of significance could be parametric test, or we can have non-parametric test. Usually qualitative data or not normal distributed data, which has skewness, not normal distributed data. These are called as non-parametric tests, whereas the quantitative data or the normally distributed data, these are called as the parametric tests. So in your exam, you have to see two things, beta. So first is you have to see how many groups are there. That is the first thing. Second thing that you have to see is what type of data is there. So two things, if you see that what type of data and how many groups are there, you will get the answer. If it is single group beta, it is called as a paired t-test. If it is two groups, it is unpaired t-test. If this is three or more groups, it is called as ANOVA test, analysis of variance. Single group for qualitative, usually we use a test called as McNemar test. For two groups, chi-square test. And then in case we have three or more groups, we can have different options, ordinal data or nominal data. But generally speaking, just remember it is a Kruskal-Wallis test. It is a Kruskal-Wallis test. And in case of ordinal data, where you have three or more groups, we can also use a Wilcoxon rank test. Wilcoxon rank test. So anyways, if you know this background theory, I don't want to bore you with the background theory. What I wanted to discuss with you is that this question is almost 100% strike rate MCQ. If you don't know this question, then I think you'll be losing a lot of marks in almost every exam, because this is 99% of the exams will ask you a question on test of significance. So please note that this topic is saying that there were 100 people, you measured them before and you measured them after. So how many groups you're talking? You're talking about a single group. And because it is a single group, and what is the data? The data is birth weight. Birth weight is what quantitative data. It is a normal distributed data. So therefore, the correct answer is a paired t-test. So what is the best answer you would like to mark, bache? It is a paired t-test. Very important for your MCQ exam. It is not ANOVA because there were not three groups. Chi-square because you are not talking about the qualitative data. Independent sample t-test. This is other name for unpaired t-test. Independent t-test, also called as a student independent t-test. It is the other name for unpaired t-test. So therefore, that is also not the correct answer. And now let us move to the next MCQ. While analyzing the prevalence of disease in some regions, you divide them into three groups: low burden and medium burden and high burden, and select one from each. What type of sampling is this? Stratified, systematic, convenient sampling, or simple random sampling? So it's a very simple MCQ that, let us say this whole area is there. Out of 1,000 houses, you want to select 100 houses. You want to select out of 1,100 houses or 100 individuals you want to select. So one is you can do take every 10th person. Every 10th person was selected, or 5th person, or 20th, and then you take the whole data. This is called as a systematic sampling. Systematic sampling, where you are selecting every nth person or 10th person or 5th person. So this is not the case which is happening in this MCQ. So systematic is out. So many students got confused that maybe it was systematic. It is not systematic. It is very simple question that what is happening over here in this MCQ beta. What is happening is that this is your total data, and this you have divided based on a third variable. You divide them into low, medium, low burden, medium burden, and a high burden area. So you divide them into low, medium, and high, and then you are selecting one from each. So what you are trying to do is you're dividing the population into different strata, and based on the strata, you are taking the population. So this is technically called as a stratified random sampling. It is not convenient sampling. Convenient sampling is just generally we take the sample, and it is not it is actually a non-probability sampling, not a very good type of sampling. Simple random is based on lottery method or random numbers method, which is again not the case. So the best answer you would like to mark in this MCQ is stratified random sampling. Let us go to the next big heading about mother-child health, demography, and family planning. Let us see what the questions are there. Relatively super duper easy, chakka MCQ. You get 6er on every MCQ. These type of questions were there. So first MCQ, the in mother-child health, RMNCEH+A strategy by Ministry of Health and Family Welfare aims to provide comprehensive health care across the life stages. The target demography for the latest RMNCEH+N includes which of the following? Mother-child health, family planning, geriatric health, adolescent. Arey beta, this chapter is mother-child health. So obviously, if it is mother-child health, mother health, family planning, adolescent will be included. Geriatric will not be included. So answer is A, B, and D only. Common sense. I don't think it's a brainer MCQ. So just bore you with the theory. Please note that this is RMNCEH+N. This is reproductive health, maternal health, neonate or newborn. This also has been MCQ, whether it is neonate or a newborn. And then C stands for the child. A is adolescent health, AH. And last N is nutrition. This also has been asked as MCQ, that what is the last N. And nutrition is one of the prime areas. The main focus of the program is on the nutrition aspect. So this is what is the RMNCEH+N. Going to the next MCQ, a numerical based MCQ, a region has a population of 6,000 people below 15 years and 12,000 between 15 to 65 years. So less than 15 years, let us write it down, 6,000 individuals. 15 to 65 years, 12,000 individuals, and more than 65 years, we had 2,000 people. Calculate the dependency ratio. But it's a super duper easy MCQ. Dependency ratio is given by the formula total number of dependents over independents into 100. So in this MCQ, you had total number of dependents. Which are the dependents? That is age less than 14 years and age more than 65 years. They are the dependent population divided by the independent. So common sense, 6,000 plus 2,000, 6,000 plus 2,000. These are the dependent population divided by the 12,000. So the correct answer to this is 0.66 or 66.7%. And that is your correct answer. Option A is the best to be marked. Generally, beta, if they ask you dependency ratio is usually multiplied with 100 and expressed as percentage. It is not expressed in decimals, generally expressed in percentage, but that's okay. You were supposed to get the easy MCQs, right? So coming to the next MCQ, best time to insert IUD. So this question, I would say, is a tricky MCQ. I have no single best answer, correct answer. But yeah, best time to insert IUD. Immediate postpartum, within 48 hours, after 7 days of menstruation, within 7 days of the start of the next menstrual cycle. So generally, I think everybody should know it, that what is the time of insertion of intrauterine device. If it is inserted within 10 minutes of the delivery of placenta, what is it called as? It is called as post-placental IUCD insertion. And if you inserted after 10 minutes but within 48 hours of delivery, it is called as post-partum IUCD insertion. And if it is inserted after 6 weeks after delivery, it is called as interval IUCD insertion. And fourth is in a non-pregnant, non-pregnant and non-lactating female. Non-lactating female, when do we insert it? It is usually inserted within 10 days of start of menses. Within 10 days of start of menses, we should be inserting the intrauterine device. So if you know all this, can it be inserted within immediate postpartum? Yes, it can be inserted within 10 minutes. Within 48 hours? Yes, it can be. Within 7 days of menstruation? Yes. So within 7 days, of course not. So if you're going to, I don't know, because there's no best time. You can't say best time. You can mark this also as the best time. You can mark immediate postpartum within 48 hours also as the best time. But if in case somebody is like forcing you, okay, if somebody is forcing you to mark because of certain reasons, not certain reasons, because of practical reasons, the best answer would be option number B. But all said and done, I personally can't say that A is better than B or B is better than C. But if somebody is forcing you to answer, the single best answer should be within 48 hours of delivery. I have a rationale for this. The rationale is, beta, what is the use of intrauterine device? These are working as spacers. So what do you mean by spacers? That are after the one birth, the second childbirth should be delayed. So the second childbirth will be delayed when? Because only if the first child was born. So the best time of insertion of intrauterine device is always within 48 hours of delivery. That gives the best possible effective use of intrauterine device for contraceptive benefits. Coming to the next MCQ, minimum age for consent by individual to MTP is 16 years, 18 years, 20 years, or 20 to 25 years. So as far as this MCQ is concerned, beta, there is no minimum age for doing MTP. If a female wants MTP, and unfortunately, if there is any social injustice or there is unwanted pregnancy, female has the complete right to get the medical termination of pregnancy. There's no minimum age, even based on like philosophically thinking and humanitarian basis. I don't think there has to be any minimum age. Like you can do MTP only after this. But yes, the question could have been that the minimum age for consent by individual. So please note that for the consent by individual, the minimum age is 18 years, below 18 years for minor females, and for females who have any kind of mental issues or mental imbalance, or they are not mentally competent to take the decision. In those cases, beta, the guardian, the legal guardian, whoever is taking care of the female, is responsible for giving the consent for a medical termination. But generally speaking, 18 is the minimum age for consent to be given by the individual for their MTP. Consent by two doctors is required at what gestational age? This is as per the latest MTP Amendment Act 2021, which was again revised in 2022. And the consent of two doctors is required. Consent by two doctors, beta, it is required from 20 to 24 weeks of gestation. This has been discussed multiple times, so therefore 20 weeks is the single best answer. If you talk about the Medical Termination of Pregnancy Act 2021, so the two doctors is required for 20 to 24 weeks. Below 20 weeks, only single doctor consent. After 24 weeks also, the medical termination of pregnancy can be done, but provided it has to be approved by a state level medical board. So the medical board will decide whether the MTP has to be done after 24 weeks, yes or no. And now let's go to the next MCQ. Which of the following describes the metabolic status of marasmus, beta? When I think we were in 8th, 9th class, we used to discuss about marasmus, kwashiorkor, protein, energy, malnutrition, and so simplicity. In INI-CET faculties or people, they ask the question on this. So what else you could be thankful to the God for, right? So options given were edema due to severe protein deficiency, severe calorie deficit with low serum protein, increased insulin levels with reduced lipolysis, positive nitrogen balance with low cortisol levels. If you talk about kwashiorkor and marasmus, beta, two different extremes of the protein energy malnutrition. Kwashiorkor is where there is low deficient, like more marked protein deficiency, and because of low protein deficiency, there is again energy deficiency also. But the main feature is low protein energy ratio in the diet and marked protein deficiency, which of course low protein will lead to edema in the child, wasting, liver enlargement, hair pigmentation, skin pigmentation, flag signs, and so on. But of course the main marked feature is edema in kwashiorkor, and that because of the edema only, I think if you recall, like weight for height and weight for age is not a very good parameter to assess malnutrition in kwashiorkor. We have to take a separate classification which is called as the Wellcome Trust classification, which is used in cases of edema, right, for kwashiorkor. Another extreme of the protein energy malnutrition that we have is marasmus. Marasmic child is more calorie deficient or more energy deficient, and because there is energy deficiency, of course there will be protein deficiency. There is severe muscle loss, there is more lipolysis and more muscle myolysis, muscle wasting is there. There is low total proteins and albumin and low globulin also. But if you talk about which protein is more deficient, it is always albumin is markedly low. So this is like what is marasmus. So let us see the options. Edema due to severe protein deficiency. This is not correct. There is no edema. Severe calorie deficit. Yes. With low serum protein. Definitely yes. Increased insulin. Why would proteins be increased, right? Reduced lipolysis. Why would fat be retained? That is not correct. Positive. Now, why would the nitrogen balance be more? And low cortisol, of course, it can be there plus or minus. So generally, which is the best answer you would like to mark? Option B is the direct MCQ, direct answer. Coming to the big mega chapter about communicable disease, non-communicable disease, and the related national health programs. So that's a huge chapter. Let us take on the MCQ. According to the National AIDS Control Program, which of the following is not a high-risk group? So I think all the students who have attended my classes, they must be smiling right now and laughing right now that this is the question we spend Less time, but a lot of information on this, and this is 100% strike rate MCQ. According to the National AIDS Control Program, which of the following is not a high-risk groups? So if you remember that this is what is the table we used to discuss in the classes as well as in all the lectures also. We have the general population, the bridge population, and the high-risk population. High-risk population are like the female sex workers, male having sex with male, IV drug abusers, transgender population. Bridge population is not including the high-risk groups. So high-risk groups are 4 groups. These are 1, 2, 3, and 4. The bridge population are those population which will transfer the infection from one point to another, which includes the 5th and the 6th one, that is the single male migrant laborers and the long distance truckers. Very frequently MCQ asks, long distances truckers is not a part of high risk groups, and this is what this MCQ also. Another MCQ is, who is the indicator for general population HIV? It is ANC females. So best answer over here, I think no point of discussing it more. Long distance truck drivers, they are not high risk group. Direct question, direct answer. Complete clinical cure for malaria can be achieved by, again this question they had said that there is a complete clinical cure for malaria can be achieved by artemisinin, sulfadoxine, pyrimethamine, chloroquine, and primaquine. So of course the question is with multiple options, right? But now it is difficult to choose that which 3 have to be chosen or which 2. If it was all 4, we could have gone with all 4, right? But as far as the collection from students was concerned, like they said that there were 3 options which are matching. So if you look at all the radical cure and the clinical cure, but a clinical cure is primarily with ACT, with artesunate combination therapy, and with chloroquine. Primaquine is more responsible for, it is given for a longer period. It prevents what? It prevents the relapse of malaria. It actually prevents the relapse of malaria, and it prevents the future recurrence of malaria. So if you're getting a single best answer, like you want to give the best answer, that the clinical cure is predominantly mainly due to, it is mainly due to 2 drugs, beta chloroquine if you talk about the Vivax thing, and with ACT if you talk about the falciparum. So the best answer I would like to mark is option A, B, and C over here. Primaquine is also used for clinical cure. Please note, I'm not disagreeing on that. But actually, if the question is saying, like, there's no option with A, B, C, and D, right? So if the best answer would have been A, B, and C, because this is what is the clinical cure, and primaquine is not actually for the clinical cure. It is actually to treat the to prevent the relapse of malaria, and that's what the question was actually asking. So just a very quick recap about the treatment of malaria. Malaria treatment, if you recall, beta, we can have for Vivax. Vivax, we can give 2 things. We can give chloroquine, plus we also give primaquine. Chloroquine is given at the dose of 25 milligrams over 3 days, day 1 and day 2 and day 3. So day 1 is 10 milligram, day 2 is 10 milligram, day 3 is 5 milligram. Primaquine, it is given at the dose of 0.25 milligram, and it is given for 14 days. Why do we give primaquine? It is to prevent the relapse. Talking about the falciparum, we have to give ACT. This ACT can be of 2 types. We can have ACT-AL or ACT-SP. AL is artemether and lumefantrine. It is given in the northeastern states. SP is given in the all other states. All other states, they are going to receive the sulfadoxine and pyrimethamine. And plus, we can also have to give primaquine. This is given at the dose of 0.75 milligram per kg body weight. And this is given on day 2, single dose. It is given on day 2 as single dose. So please note, chloroquine is 25 milligram per kg body weight. Primaquine is 0.25 milligram per kg body weight. So this is what is the dosages, and for radical cure, we have to give primaquine, including for clinical cure. Generally, it is chloroquine with ACT. ACT stands for artemisinin based combination therapy. So the best answer you would like to mark in this question is option number A, B, and C. Let us go to the next easy MCQ. Match the following vector with the disease. This question has been asked so many times in your exam, beta, which is for what? So if you recall this table we have discussed it multiple times. Please note that which are the louse-borne illnesses. Remember, louse is lazy, lazy is retired. Okay, retired. R stands for relapsing fever. E stands for epidemic typhus. T stands for trench fever, and D is dermatitis. These are the louse-borne illnesses. Flea is spreading the plague, that is rat flea. Plus, we also have endemic typhus. Tick typhus, tick paralysis, tularemia, viral hemorrhagic fever, babesiosis, all these are tick transmitted. Very frequently, they will ask you questions from this table where we talk about the rickettsial disease. Out of these vectors, if you see all the vectors, which of the following is the only one which is a flea-borne? You can see a lot of different vectors are there, right? So which is the only one which is flea-borne? This has been asked multiple times. Flea-borne illness is only one, that is endemic typhus. And can you see that louse-borne illness is epidemic typhus? Make sure you remember this for your exam. If you just recall this, if you just remember this, you can directly mark the questions better. So which of the following, let us start from below, which of the following is a louse-borne? We talked about louse-borne. So louse-borne is epidemic typhus. Louse-borne is epidemic typhus. So 4 goes with A. Then is flea-borne. Which one is flea-borne? 3 goes with endemic typhus. So this one is a flea-borne. 3 goes with B. And tick-borne. Tick-bornes are Rocky Mountain spotted fever. 2 goes with D and 1 goes with C. That is rickettsial pox. So this is the best answer. I think you would like to mark option number A, which matches all the following. So you make sure you remember this table. This table, it's a very high yield 10-star MCQ table. Make sure you remember this. Every year you get a question from this table. So now let us move to the next MCQ beta. According to the National Program for Control of Blindness and Visual Impairment, the current definition of blindness is best corrected vision of less than 3/60, best corrected less than 6/60, presenting less than 6/60, uncorrected less than 3/60 in the better eye. So what do you think is the best answer? Beta, what else do you want from God? This super duper chakka MCQ. This is what is the INI-CET has asked so easy MCQs this year. So the correct answer, beta, is best corrected vision of less than 3/60 in the better eye. This is the correct definition. If you look at the definition of blindness by the National Program for Visual Control for National Program for Blindness and Visual Impairment, the blindness is defined as presenting visual acuity of less than 3/60 in the better eye with the available correction. They just say, because this definition has been taken from the NPCB survey beta. When we go out to do the survey, we have to take the best available correction at that time. So which is generally corresponding to the same answer, best corrected vision in 3/60, less than 3/60 in the better eye. Option A is the correct answer for this question. Let us move to the next MCQ. At a PHC under Ayushman Arogya Mandir, that is the health and wellness centers, a person presents with 2 successive blood pressure readings of 140/94, 152/92. What is the next step of management that the medical officer should do? This is such again a super duper easy MCQ, right? So start amlodipine, do nothing. Of course, that is not an option. Refer to district hospital, admit patient, start amlodipine. What do you think is the best answer? If you talk about the hypertension grading beta, there are a lot of controversies. European Society of Hypertension, American Cardiology, American Association for Cardiology and Hypertension. So you have different types of guidelines. Generally speaking, we have 2 levels of hypertension, grade 1 and grade 2. There's grade 3 is like critical hypertension. Grade 1 is when the blood pressure systolic is less than 160 and the diastolic is less than 100. More than 160 and more than 100, it is generally taken as grade 2 hypertension. Government of India, Ministry of Health and Family Welfare writes that if the hypertension is in stage 1, what is stage 1? If the systolic is less than 160 and 100 and diastolic is less than 100, then we have to start with A, C or D. A stands for the ARBs or the angiotensin receptor blockers and the ACE inhibitors, and C stands for the CCB calcium channel blockers, and the D is the diuretics. So we have to, the government of India says that you have to start as a monotherapy out of 1, 2 or 3, any one of the following. So in patients with, this is a direct screenshot from the training of medical officers for hypertension. Patients with hypertension, therapy is initiated with 1 drug. So in combination with the lifestyle modification, average dose of amlodipine, enalapril or hydrochlorothiazide can be given. So if the blood pressure is not controlled, then they go on with the 2 drugs or the 3 drugs. So generally, what is the best answer you would like to mark in this option? So the correct answer is start amlodipine 5 mg OD for 1 month and then do the follow up. Please note that the review has to be done at 4 weeks, at least for 4 weeks. We give the treatment and then we review the management. Coming to next one, which are the following strains of HPV more commonly responsible for cervical cancer? 6, 11, 16, 18. So they have asked that more commonly which one is responsible. Please note that the high risk for HPV types and low risk HPV types, low risk HPV is with the 6 and 11, whereas the high risk is with 16, 18. This is the most common, and other are 31, 33, 35. All these numbers are there. You have to memorize these numbers. So the high risk most common is with 16 and 18. That is what is frequently asked MCQ. Going to next MCQ, which vaccine is contraindicated in a child with SCID, severe combined immunodeficiency? So in case of immunodeficiency, when do we say a person is immunosuppressed? We will say that the person is immunosuppressed if the CD4 count is less than 200 cells, or if the relative CD4 count is less than 15% of the total T helper cells. So then we say that the person is immunosuppressed. In case of immunosuppression, beta, live vaccines are to be contraindicated. Live vaccines are not given. Which of the following is live, beta? MMR is a live vaccine. MMR stands for measles, mumps and rubella. It is a live vaccine. Hepatitis B, it is a recombinant vaccine, and it is kind of a safer vaccine, hepatitis B. DTaP, D and T, these are the toxoid, whereas the acellular, it is the killed vaccine, and D and T, these are the toxoid vaccine. So it is kind of a mixed vaccine, you can say. IPV is definitely the Salk strain, and Salk strain is, please remember, a killed vaccine. So which of the following is contraindicated? Common sense, the live vaccine will be contraindicated. And now coming to the last section about the miscellaneous topics, beta, which is the law under government which ensures the medical data security in India? HIPAA, DPDP, PNDT, GPDR. So if you talk about all these beta acts or the protection acts that we have, so PCPNDT, that is the Preconception and Prenatal Diagnostic Technique Prohibition Act. It was started in 1994. It is to prevent any sex selection. So PCPNDT is not about data security. GDPR, that is used in European Union. Yes, it is for the data security. And the HIPAA is used in United States, and most of the North America is using it. Health Insurance Portability and Accountability Act. It is to regulate the patient information, usually talking about the medical records for the patient only. So yes, it is for data security. And third is the DPDP, that is the Digital Personal Data Protection Act 2023 of India. It regulates any personal data, and it helps in having a more strengthened economy, the digital economy, and also to prevent any cyber security attacks or hacking or transparency in the system. It also includes the medical data. So the best answer, which law under the government? So obviously we are going to give the Indian exam. You're not giving a US exam. If you were in US, you would have given HIPAA. If you were in EU, European Union, you would have given the GDPR. So PCPNDT, that is not about data security. The correct answer over here is DPDP, that is the Digital Personal Data Protection Act 2023. And now moving to the next one, during Mahakumbh Mela, which was the recent Mahakumbh Mela, the government set up healthcare camps and mobile medical units for surveillance. So that's important. They kept it for surveillance. Surveillance is continuous watch or observation with scrutinization with a positive support. A syndromic surveillance is done for fever, diarrhea, and respiratory symptom. What is the primary reason to do this? It's a very intelligent, practically usable MCQ, I would say, and it is important for if you just apply a little bit sense to the MCQ, it comes out with the correct answer. So the options given were to confirm individual diagnosis with additional tests, to reduce the medical personnels, for immediate quarantine of the symptomatic individuals, for detecting the warning signs. So starting from the start, to confirm the individual diagnosis with additional tests, that is not the correct answer, because in a Mahakumbh Mela, you don't want to do additional tests and to do individual diagnosis. There's not like opportunistic screening. To reduce the medical personnel, obviously that is not the correct answer. For immediate quarantine of symptomatic individuals, yes, this could have been making sense, but the problem in this MCQ, in this option, I will tell you, many of you must have already understood that you are doing immediate quarantine, question says, of the symptomatic people. Question says, how can you quarantine the symptomatic people? Quarantine is done for apparently healthy individuals, na? Quarantine, how can you do it for symptomatic people ko to we do isolation? So that is not the correct answer. So option C is also the not a correct answer. For detecting a warning signs, so that is just to have early outbreak assessment. If there are more people with any diarrhea, with more people with fever and cough, more people with respiratory symptoms, then of course you watch about the outbreak. So option D is the correct answer to be marked in this question, and that is your answer. And with that, I think we finished the whole discussion. Thank you so much for joining in the discussion. I wish you all the very best and keep on revising. All the best, beta.